living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
The rate of colorectal cancer cases has gone down over the last 20 years, but it is still the third most common cancer in the world and the second most common cause of cancer deaths in the United States. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to talk about why colorectal cancer is so dangerous and how we can protect ourselves against it. Stay with us. Welcome back to Healthy Living for Life. Today, joining us is our own Dr. Doug Kunstweiler from Mountain Pacific Quality Health, and he is our Chief Medical Director. And we're so thankful to have you here, and it's always so fun to talk with you.
It's good to be here, thank you.
Even about something like colorectal cancer, which is not that fun to talk about, but really important.
Yeah, it's not very glamorous.
Yeah, but it's pretty common. So let's learn a little bit about it this morning, and let's start by talking about what the heck it is. So what is colorectal cancer? And then sometimes we say colon cancer. Are those the same things or different?
Yeah, so the colon is the large bowel, and the lower end of it is the rectum. And so colorectal sort of covers the whole area.
Okay, gotcha. So it is different to say colorectal cancer versus colon cancer. Colon cancer is more specific?
Yeah, it's a smaller area.
Okay.
Yeah.
Got it. And do we know what causes colorectal cancer?
Well, cancer in general is unregulated growth of tissue that interferes with normal tissue. And if that unregulated tissue is growing from the lining of the colon, then that by definition is colon cancer.
Okay. Are there different stages of colorectal cancer?
There are, and staging is basically a way of categorizing how far a cancer has spread. So there's a common staging used that consists of 4 different stages. Now, each of those 4 is broken down into substages. But in general, stage 1 cancer is limited to just the local area where this unregulated growth first started. In stage 2 cancer, it spreads farther. So in colon cancer, stage 1 means it's just a little area in the lining of the colon.
Okay.
In stage 2, it has spread to the deeper layers of the colon. The colon has a muscular layer that propels the material through it. And in stage 2, it has spread into that muscular level. Stage 3 cancer has spread outside of the colon to the lymph node system. And the lymph node system in our body is where infections are fought, where foreign bodies are isolated and fought. So in stage 3, it spread to a lymph node. Mm-hmm. Stage 4 means it has spread beyond the lymph node system into other organs like the liver, the lung, the bone, brain. So those are kind of roughly what the stages are. And that system was developed to help guide treatment, basically.
Okay. And we definitely want lower numbers if we have to deal with cancer.
Yeah, you want to catch it at stage 1.
And so
or even stage 0 before it becomes cancer.
Yes, and we're going to talk about that too for sure. But does someone know if they're in a certain stage or there's symptoms that they're going to start to notice?
Well, that's part of the reason why colon cancer is so dangerous. First of all, because it's fairly common. But secondly, because it often doesn't present with very many symptoms until it has already spread. So that's what makes it dangerous. The most common symptoms are a change in bowel habits, and that means either constipation or diarrhea that's out of the ordinary and that lasts more than, say, a week or so. So that's one common symptom. Another one might be blood in the stool or dark tarry stools. And another one would be iron deficiency anemia. Sometimes people present with fatigue, and when you're evaluating why they have fatigue and they're tired all the time, you find out that they have very low red blood counts. Well, colon cancer can cause a slow, steady leak of red blood cells, and that can, over time, make you dramatically anemic. And sometimes that's the only symptom that people present with. Sometimes they have abdominal pain, but that really isn't very common, and that's usually at stage 4 where it's causing a lot of trouble.
Okay.
So that's why it's dangerous, and that's why we need to do screening.
Right, yes, and I want to learn more about the screening, but before we get there, in my little pitch before the break, I talked about that colorectal cancer is the second most cause of cancer death in the United States. Do we know why it's so common here?
Well, it's thought that the Western diet is low in fiber compared to underdeveloped countries, and we think that that is one of the principal reasons. Probably also just because we are a more industrialized society, we are exposed to more industrial toxins, and that probably plays a role in this as well.
Okay, and so other than diet and possible toxins, are there other risk factors?
Well, age is one of the main ones, and even though we're seeing it show up at younger ages, it's still uncommon in people who are under 40. So most colon cancer shows up in adults who are 50, say, to 70 years old. So that's age in and of itself is a risk factor. If you have an inflammatory bowel disease, which is basically ulcerative colitis or Crohn's disease, then your risk of developing colon cancer goes up pretty dramatically. If you have excessive alcohol use, if you are a smoker, if you are morbidly obese, those are all risk factors. Diabetes is a risk factor, so those are some of the common ones. And then there are some genetic causes that run in families that can raise your risk.
Okay, what about lifestyle?
Well, that's part of what I was alluding to. Okay. A sedentary lifestyle raises your risk, so if you're more active, that helps to guard against colorectal cancer. In terms of diet, the more red meat, the more processed meat that you consume, the greater your risk is. So a Mediterranean type diet that is heavy on fruits, vegetables, and whole grains is thought to be preventative.
Okay, great. One more quick question. I've heard that you can take low-dose aspirin to help prevent colorectal cancer. Is that true?
It actually is true, and it's not confined to low dose. You can take high dose, regular dose. Also taking other non-steroidal anti-inflammatories. Those are the medications like ibuprofen or naproxen. They also help to prevent against colorectal cancer.
Interesting. Okay, cool. And we know screening is the most important prevention, and we're going to talk about that, but we do need to pause here for a quick break. And we are going to talk about the different kind of screenings, but which one might be right for you so that you can catch it at stage 0, like Dr. Kunzweiler said. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. We're still chatting with Dr. Doug Kunzweiler, and we are going to talk about screening now, but first let's talk about the age change that happened. It used to be that people started being encouraged to do screening at 50, now 45. What happened there?
Well, when I first got into medicine about 100 years ago, it was unusual to see anyone under the age of 50 who had colorectal cancer, and so screening was recommended to start at age 50. In the last 10 years or so, we've seen a somewhat alarming trend of cancers of the colon showing up at progressively younger ages. It used to be very uncommon to see anyone in their 30s, and now we're seeing that more and more frequently. So therefore, the American Cancer Society and the American Gastroenterology Society have recommended that we start screening people at age 45.
Are there people who should consider even earlier than that?
Oh, absolutely. If you're one of those unfortunate people who has ulcerative colitis or Crohn's disease, your screening needs to start at an earlier age. If you have a strong family history, then you probably should start screening at an earlier age. And it's really best to go in and talk to your provider about that, because there may be other risk factors you have in your history that might lead to wanting to screen earlier.
Okay, and how often should someone get screened?
Well, that depends. If you have a colonoscopy and it's basically pretty normal, maybe they find 1 or 2 small polyps, you're good to go for 10 years. If, on the other hand, you have a number of worrisome lesions, they might recommend that you be rescreened in 5 years. If you have any of these other risk factors that we've talked about, such as ulcerative colitis or Crohn's, you might need to be screened every 2 or 3 years. It really depends on your history, your family's history, and what other risk factors you have.
Okay, and does age play in there? I actually have a stat here that says the Centers of Disease Control and Prevention, or CDC, recommend that adults age 45 to 75 get screened regularly. But the decision to be screened for those age 76 to 85, so even older, should be made on that individual basis. So what's that about?
Yeah, and that's because you're trying to balance risks versus benefits when you're talking about screening. And so if you are at an advanced age and maybe you've got bad other chronic illness like heart failure or chronic lung disease, you have to look at the situation and say, is this screening likely to improve the quality of life, or is it likely to prolong life? And in the face of some other really debilitating chronic disease, it may not be worth it, it may not be necessary to do that screening.
Okay. And what we're doing when we screen is looking for polyps, right? And so what exactly are those?
So a polyp is a little exuberant growth of tissue, pretty small. Most of them are less than a centimeter, about a 1/4 inch or so, that grows on the lining of the colon. Most of them are benign, but this is where cancer starts. The cells of this polyp can go awry and start to grow in an uncontrolled fashion, and that's where the cancer starts.
So you said most of them are benign. So how worried should we be if the doctor finds polyps?
Well, if you have polyps, you want the doctor to find them. That's what the whole value of colonoscopy is, that you can find these polyps before they turn into cancers, and they can be removed safely through the colonoscope at the time you have your colonoscopy. So the colonoscopy is not only diagnostic, but it also is a way to treat these polyps before they have a chance to develop into cancer.
Okay, and so let's talk about the different types of screening that we're doing to look for those polyps. What are they?
Well, as we've talked about, colonoscopy is sort of the gold standard because you can visualize the whole colon, and if you find a polyp, you can remove it. Non-invasive testing, there are tests that look for DNA in the stool, so you can submit a stool specimen, and this is like the Cologuard that you see advertised on television. You get a box in the mail that shows you how to submit a stool specimen, and you send it back, and they analyze it, and they can detect abnormal DNA of cancer cells in that. So that's an alternative screen that doesn't require sedation, that doesn't require a prep. The other way is to look for evidence of blood in the stool, and that's called the hemoccult, or the occult blood test. That's not quite as sensitive or specific, and in order to really get a valid study of that, you need to not eat red meat for a couple of days before you submit the sample.
Okay.
But colonoscopy really is the gold standard.
Okay. And so as a patient, do I have a choice? What should I be talking to my doctor about as far as which screening is right for me?
Sure, you always have a choice. And there are some people who just don't like the idea of a colonoscopy. They don't want to be sedated. They don't like the idea of having a procedure. And so for them, one of these DNA detecting tests might be a better option. You really should go talk to your provider about this, because if your risk is high, then colonoscopy is really the preferred test and the best option for you.
And what I've heard most often is for the colonoscopy, really the prep is the most difficult part. Can you talk about what people need to do to prep?
Well, yeah, I can talk from personal experience.
Yeah, me too.
I had my colonoscopy, and for a couple of days ahead of time, you're supposed to go to a low fiber diet, so sort of cut down on the fruits and vegetables. Then a day, or sometimes in some preps 2 days, you go to a clear liquid diet, and then the day before your colonoscopy, you start on a liquid that helps you empty your bowel out. And I have to say that it really wasn't all that unpleasant. You know, it wouldn't be something I'd want to do every week, but you know, you get a good book or you get a good movie and you curl up with it, and you just, you know, relax. And the procedure itself, I don't know what your experience was, but I was sedated, and I just had a really nice nap and woke up and had no symptoms. I was fine.
Yeah,
So it's really not that bad an experience.
No, I agree. I know different people have different experiences with the prep part, but I didn't have a hard time either, and I thought
I didn't have any bloating or pain or discomfort at all. It's a little bit inconvenient, but you just prepare for it, and it's not a big deal.
Right, a day or two out of your life to make sure you're healthy.
And it could prolong your life significantly, so it's worth it.
Okay. All right, we need to pause here for another break, but when we come back, we're going to talk about cancer treatment and what happens if one of those polyps does raise a red flag and you need some help. We'll be right back after these messages. Welcome back. Dr. Kunzweiler is still with us, and now let's talk about treatment, and let's just jump right in. What are the options for treatment if someone is diagnosed with colorectal cancer?
Well, surgery is often a treatment, and that can be curative, especially if you catch it at an early stage. Some very localized cancers can be removed through the colonoscope safely, so you don't even have to have an abdominal incision, but surgical removal is an option. If the cancer has spread beyond what surgery can do by itself, then chemotherapy, which is medication that kills the cancerous cells, radiation, which also will kill some cancerous cells, that's an option. And then there are some newer therapies that are being developed that are immunotherapies, where medication is essentially an antibody that attacks the cancerous cells. So that's pretty exciting new territory that's being explored and is being used.
Cool. So how is the option determined? Is that just a conversation between the doctor and the patient?
Yeah, and it depends to some extent on the staging.
Okay.
So if you have stage 4, surgery probably is not going to be curative. Sometimes surgery is still used to prevent an obstruction of the bowel or that sort of thing. But it really depends on the staging, and then a discussion and a joint decision by the patient and their provider as to what will work the best and what will be the best tolerated.
And I think most people probably know what the side effects are if you're doing chemotherapy, but what about surgery or even this immunotherapy? Are there side effects people should know about?
Well, yeah, the immunotherapy seems to be pretty benign. Chemotherapy, of course, the biggest risk is that you're not only killing the cancerous cells, you are killing some normal cells as well. And unfortunately, you often kill the white blood cells in your bone marrow, and that leaves you susceptible to serious infections. So that's a side effect that people don't always consider, but that can be very, very important. Radiation, you're trying to just irradiate the cancerous cells, but of course you're also getting some normal cells, and so you can have problems with pain and diarrhea and that sort of thing. And surgery, of course, you run the risk of surgical complications like bleeding or infection or loss of function somewhere else that was unintended. So all of these have significant risks, and they need to be discussed with your provider, whoever it is that's going to be treating you, and it's a shared decision.
And hearing the word cancer, that's always scary. And so thinking about the logistics is difficult. What questions should I make sure I'm asking? How can I make sure I'm present and understanding what my treatment options are?
Yeah, as soon as people hear the word cancer, their brain pretty much shuts off. And that's irregardless, even medical people, when they get a diagnosis, their brain stops working. So I recommend taking somebody that you trust with you, a family member or friend, and doing some research ahead of time, writing down your questions so that you don't forget them. But you should sit down and discuss, what is my prognosis? What do you expect is going to happen? What do you think would be the best thing for me to do? What likely side effects or complications am I looking at? And you just want to know what are my options? What are the potential benefits? What is the potential downside?
And I would imagine there are support groups out there for folks too. How do they get into those?
Yeah, there certainly are. And I think the best way is go to the American Cancer Society website, and they can connect you with other support groups. There's lots of good information on the Mayo Clinic website, the Cleveland Clinic website. They really have some very well done tutorials and information that people can easily understand and access.
We talked about colorectal cancer being high as far as death rates go, but let's flip the coin. What are the survival rates like?
Well, they're not too bad for colorectal cancer, taking all comers. And when we're talking about survival rate, what we mean is of people who are diagnosed, how many are still alive 5 years after the time of their diagnosis.
Okay.
So for colorectal cancer, it's about 65%. So 65% of those people who are diagnosed with colorectal cancer are still alive 5 years later. Now, that's the average, so the spread can be quite large. If you are stage 1, 90% of those people are going to be alive 5 years later. When we compare colorectal to some other cancers, brain cancer, it's down to about 10% of people are alive 5 years after their diagnosis. For pancreatic cancer, it's even less than that. Something like 7 to 8% of people are left alive after 5 years. So 65%, given the broad outlook, is really pretty good.
Okay, but you want to catch it early, so get to those screenings.
You want to be in that 90 to 100% stage, yeah. So you need to go get your screening and get discovered in stage 0 or stage 1.
Yeah, perfect. So we're almost out of time. Any final thoughts, or were those the?
Yeah, well, I would say don't
thoughts?
be afraid of the screening. Don't be afraid of colonoscopy. So.
Yeah, they're not that bad.
They're not that bad.
Yeah. Thank you so much, Dr. Kunzweiler. We appreciate you being here today.
Thank you.
And thank you so much for joining us. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.